I'm joined by Health Secretary Sajid Javid. Good morning, Health Secretary.
Good morning.
What do we know this morning about the spread of Omicron, infections and, crucially, hospitalisations?
Well, ever since we've learnt about this variant, our strategy has been clear to buy time to assess it and time to build our defences. We're learning more about Omicron all the time, but the truth is we still don't know enough. And there's gaps in the data that we have. There are significant uncertainties as we look ahead, but we must work with the data that we've got and not let the perfect be the enemy of the good. So let me just share with you very quickly what we do know. First of all, we know that Omicron spreads very, very quickly. We can all see the rising case numbers, but we know that there are many more people behind those case numbers that are infected because not everyone is taking a test, or there's always a delay in getting test results. And so the actual number of infections would be significantly higher than what case numbers suggest. And we know that case numbers and infections are doubling at around every 2 to 3 days. And that's observed data here in the UK, from South Africa, from Netherlands, Denmark. That's observed data of Omicron. The second thing we do know is around vaccines. So we know that 2 vaccines are sadly not enough to protect you against symptomatic disease, but 3 vaccines are. 3 vaccines are excellent in the protection they provide. That's why we've focused very heavily on our booster programme in the last few weeks. I'm pleased to say in the last week in England, we've seen 4 million boosts, over 4 million boosts. We've seen new records being hit every day. I'm told that yesterday was a new record day as well. And so that is a very high level of protection we can build on. But the third thing that we don't know enough about, and this is important, Trevor, is that so we know about the spread, we know about the vaccines, but we don't know enough about the severity of Omicron. And so there is data from South Africa, when you look at their hospitalisation rate versus Delta, that definitely suggests they got a lower hospitalisation rate. But we don't know whether if that means the virus itself is intrinsically less severe, or does it mean that South Africans have more protection through natural infection or vaccines or in other ways. So, and just a final point, because if I may, is that with the severity, that even if it turns out to be less severe, and therefore a smaller percentage of people are hospitalised here in the UK than with Delta, a small percentage of a large number of infections could still mean a significant number of hospitalisations.
OK, that's a good, complete, comprehensive picture. Just one small detail. The reported number of infections running something like 90,000, maybe 100,000 a day, but you've just said that you think actually that probably means that the actual level of infections is much higher. We're being told that, for example, it could be as high as 300,000. What is the multiple to which you're working right now? If the official figure that we're seeing is 90,000, what do you really think it is?
Well, so let's to be clear about this. You said reported number of infections about 90,000. Not infections, that's case numbers. And the difference between a case and an infection is cases are a subset of infections. That's where someone was feeling unwell, they've got a test, and it's been confirmed. So the 90,000, by the way, isn't just Omicron. That is Delta, still predominantly Delta, and with about a significant degree of that being Omicron. But infections, what we already know, perhaps I can better explain with Delta, because we've got much more data on that. Typically, the case numbers represent around a fifth or a quarter of total infections at any one time. And so with Omicron, we know that the infections the cases that we're getting, the confirmed cases, it will be a subset of total infections. But because of the speed at which it's growing, doubling every 2 to 3 days, it's likely to be an even smaller proportion, the cases, of total infections. So it's hard to say with any kind of certainty what's the total number of infections, but we know from all this data that they are growing significantly in the community. So, for example, we know from a test called S-gene target failure, which is basically a proxy test for Omicron. It's a lot quicker doing that than the sequencing. We know that it's currently running at around 60% of all cases, all new cases in England overall.
OK, so in fact, we could be seeing a level of Omicron infection which is more than 5 times the numbers case numbers that we're seeing reported. Let me ask you about another specific issue. What do we know about the proportion of people who remain unvaccinated?
Well, we know, first of all, in terms of numbers, about 88% of the population over the age of 12 have taken at least one vaccine, and 80% have taken two. Over half the people of adults are now boosted. So that's really good in terms of great set of numbers, especially the boosters, the biggest booster program in Europe. There's about, let's say, around 10% of the population that remain unvaccinated. And we know in hospital, when you look at hospitalizations, they make up a disproportionate amount of those that are severely ill. In fact, if we look at those that are the most ill in hospital, needing the most care and attention, around 9 out of 10 of them are unvaccinated. And if I can say, Trevor, because it's a really important issue, that people have had over a year, almost a year now, to get vaccinated. There's still 10% of our population that have chosen, for whatever reason, not to get vaccinated.
We're talking about 5 million adults plus.
Yeah, 5 million plus. And I just cannot emphasise enough the impact that they are having on the rest of society. They must really think about the damage they are doing to society by they take up hospital beds that could have been used for someone with maybe a heart problem or maybe someone who's waiting for their elective surgery. But instead of protecting themselves and protecting their community, they choose not to get vaccinated. They are really having a damaging impact. And I just can't stress enough, please do come forward and get vaccinated. It's a really positive thing to do, not just for yourself, for your loved ones, but for your community too.
I've dwelt at some length on the numbers because this is at the heart of the dispute that's brewing amongst your parliamentary colleagues. You suggested, for example, at the beginning of this week that we could be up to 200,000 cases a day.
Infections
a day. The trends don't necessarily, as we understand the data, suggest that that's quite where we are. Some of your colleagues think that you're overstating the data in order to allow you to bring in more restrictions on the population.
Well, in fact, the data we use is the data as it's being observed. So we know case numbers. We understand a lot more about COVID and infections over the last couple of years. A lot of data has been built up. Globally, through scientists around the world, they understand a lot more about that. It is true, however, that you can't be certain about everything, especially with a new variant. We can see already in the community how quickly this is growing. But when analysis is done, so for example, the SAGE committee of scientists that advise government have just published what they view as their latest assessment of the situation, that they've given an analysis. And as ministers, of course, we will look at that analysis, but we can't just sort of simply accept it as, that is the fact and that is definitely what's going to happen. As ministers, we do have to challenge it. We have to look at some of the underlying assumptions and challenge on those. And also as ministers, when we make decisions on the data that we are presented with, of course, we have to think broader than just the epidemiological situation, and have to think about any action that we take, the impact that it might have on people's life chances, on businesses, on children. So ministers' jobs is to take a much broader view.
But before we get to that, what your critics would say is that you get properly presented with a range of scenarios by your scientific advisors. And what I think many would be saying is that you choose the scenario to which you are responding. And invariably, that's turning out to be the most pessimistic. So, for example, you yourself have just said that the emerging evidence from South Africa is that Omicron might be less severe than we might be. Yeah. But you've chosen to act as though it is at least as severe as Delta, so that you are actually choosing the evidence to which you're responding, rather than looking at the range of evidence you're being offered by scientists.
No, Trevor, if I may, I don't think that's the case at all. And let me explain. Is that it would be wrong, absolutely wrong for government to say, look, we think this is as severe and that's how we're going to behave, because we don't know. There's a lot of uncertainty around Omicron, and we have to accept that. There are gaps in the data, as I've said. But we have to use the data that we've got. The data that we do have is around how fast it is growing and about the vaccines.
Health Secretary, is the data you asked for. Graham Medley...
Well,
let me just put this to you.
Okay.
The Graham Medley, who's the chairman of the SAGE Modelling Committee, told The Spectator yesterday, we generally model what we are asked to model. There is a dialogue in which policy teams discuss with the modellers what they need to inform their policy. What is that supposed to mean if it doesn't mean that they're giving you the evidence that you want?
I think what it means is that they, as in this case, I think he must be referring to SAGE, which are the government's sort of scientific advisors, is that what they are modelling is the question they would have been asked, broadly put, is taking into account all the data you have both from the UK and abroad on this new variant, where do you think it's heading? I think that's the broad question. And they inevitably, and perfectly understandably, would come up with a number of assumptions that they would make. But as I've said, our job as ministers then is to obviously to look at that report. It is very sobering when you look at it, but to look at it and then to challenge, to sensibly challenge underlying assumptions.
But if the report only tells you what you want to hear, there's not much challenge involved there, is there?
Well, it's not.
He's saying that we tell the government the things that it's asking us for. We're not telling them the things that other things that we might know that they're not asking.
Well, asking in the sense, I think what he means is that asking in the sense that the government's request is tell us what you think the data suggests about where this thing is heading. It is, you know, if it was something that I was asking for, of course, what I'd be asking, who would want to ask for an outcome like the one that they're suddenly currently presenting? My job is to challenge that, and that is what the government is doing, and I think it's the appropriate thing to do. You know, there are some people, I say, Trevor, there's some people out there that think that lockdown is the answer to any new challenge we face. There are others that think that you shouldn't do anything at all. And my job, the government's job, is actually to look at the data, to make the best assessment we possibly can and act on that.
All right, let's come to what you actually have to do. You are almost certainly going to have to ask people to undertake or endure new restrictions. And it's being reported that there is a plan, or there are plans being drawn up for a circuit breaker lockdown after Christmas. I'm not asking you whether you've decided on that or not, though you can tell me, but is it true that those plans are being drawn up?
Look, we've taken measures already. I took the Plan B measures through Parliament this week, which I didn't enjoy doing one bit at all. I didn't come into government to restrict freedoms of people, but I think people understand why we are presented that action to Parliament, and we keep the situation under review. Of course, we will assess the recent report we've been given by SAGE. We will challenge certain assumptions, and we'll come to a government decision. But can I say we are entering this phase of this pandemic in a very strong position, and the reason for that strong position is because we opened up in the summer. We have the best vaccination programme in Europe, especially our booster programme. We have new treatments that didn't exist before, including antivirals. And we have a fantastic testing regime.
I'm not interrupting you for the sake of it, but we've had this conversation before, and viewers have heard that. Just to be clear, in your last answer, are you telling me that you've actually had a suggestion from SAGE that there should be further lockdown?
No, the suggestion we've had from SAGE is the one that they've published. It's in their minute. It's public. So their suggestions, I think, are quite clear there. But as I say, as government, we are advised by scientists, but it's ultimately that ministers will make a decision. And when we make a decision, there's a number of factors that we need to take into account.
If, as we are hearing from scientists and from the BMA, that the numbers are suggesting that there should be further lockdown, will the government be prepared to undertake that?
We've shown in the past, as government, in dealing with this pandemic, that we will do what is necessary, but it's got to be backed up by the data. And as I say, we are in a very...
If the data suggests that unless you act now, as some scientists are saying, and we already said the doubling numbers are dramatic, every day counts, if the numbers suggest that we should have further restrictions, will you be ready to do that?
We are watching the data, discussing it with our scientists and our best advisors almost on an hourly basis. And we will monitor that very carefully. We will keep the situation under review. But I can't stress enough how the situation today in terms of our defences is very different. You started your programme today by comparing it to Christmas last year. One big difference to Christmas last year are the vaccinations, the antivirals, the other treatments, our testing systems, and the fact that we opened up in the summer in the way that we did.
And if you did have to take some new measures, would you recall Parliament to approve those measures?
Look, if, and it's an if, the Prime Minister's already been clear to parliamentarians, if there was a need to take any further action, we would recall Parliament, and it would have to be a decision for Parliament. That is only right and proper.
Let's talk about the politics. Lord Frost went last night. Did you know that that was going to happen, and do you understand his reasons for leaving?
I didn't know it was going to happen, and I do understand his reasons. And let me just say this first about Lord Frost. I've had the privilege of working with him now for a couple of years. I think he's an outstanding public servant, and I think that the way Brexit was done and how we achieved that and achieved those successes, he's been a central architect of that. So I wish him the best, but I do understand his reasons. He's a principled man. Principled people do resign from the government. I know all about that, and that's something that's a decision for him to take.
But it's pretty catastrophic, isn't it? Half your backbenchers voted against you during the week. You lost in North Shropshire. What is undeniable is that the magic of Boris Johnson has gone. Last time we spoke about this, I asked you, and I in fact asked Mr Zahawi last week, whether Boris Johnson was still the election winner. When we spoke, you said one word, yes. Are you still prepared to say yes?
No, I think Boris Johnson...
No, just the one word.
I think Boris Johnson is the best person to take us through the challenges
the country faces. That's not the same thing as saying he's an election winner.
Yeah, we've had one very disappointing election result, and from that, you cannot take away the ability of Boris Johnson to win election after election. Remember, just a couple of weeks ago, we had a by-election victory as well. So this, don't get me wrong. I think the North Shropshire result was a very disappointing result. We have to learn lessons from it. We especially have to listen to the people of North Shropshire, and I hope that at the next election we can win that seat back. But when you're asking me about Boris Johnson, remember, it is Boris Johnson that made the decisions around the pandemic to keep Britain out of the European Medical Agency, for example, which meant that we had the biggest and the best vaccination programme in Europe, to buy antivirals, to open up in the summer. It's the same Boris Johnson that is taking us through this pandemic. OK, well, here's what the people of North Shropshire said to that same Boris Johnson with their vote, which is, after Barnard Castle, after the Christmas parties, after pretty much everything else we're hearing out of Whitehall, same question I asked your colleagues more than once this year. Why should we, when we obey the rules and you flout them, why should we pay the blindest bit of attention to what you tell us to do, Mr. Health Secretary, when you say we need to tackle Omicron? You know, I understand that. And I absolutely understand where those kinds of questions might come from. And that's why I think it is really, really important that we maintain public confidence by having that investigation that is now taking place. Sue Gray is carrying out this investigation, and that will establish the facts. You put it in the hands of somebody that you pay and who owes her job to you. Shouldn't it be led by somebody independent? Well, I think that's not... Yeah, I know this isn't your intention, but I don't think that's very respectful to Sue Gray. No. She is I'm not being disrespectful to her. She's a senior civil servant that is someone who is known for her neutrality and her probity. And I think that Javid... having a senior civil servant that is not a minister, not a politician, carry out an investigation, that's not unusual, Mr. First Javid, of all. I think that's exactly the sort of Whitehall answer that makes people feel cynical. That, of course, you would say that, but actually the question is, shouldn't somebody independent do this? And let me just ask you, because we're running out of time, let me just ask you what this is really about. In Scotland, they've already moved to tougher measures. And they're doing that with confidence because people believe in that country, in their Prime Minister. Can you look me in the face and say honestly that you believe that England will be equally compliant when asked to do tougher things by a Prime Minister
who can't even impose discipline on his own office?
I think people will. And first of all, you're suggesting there are new measures to take, and let's just see what happens. And we keep, as I say, we keep the situation under review. But if we do have to take further measures as the situation develops, if we have to do that, then I believe the British people will respond in the same way they have throughout this pandemic, whereas they understand the issues, they know just how important it is for them and their families, and they will respond accordingly.
Health Secretary, thank you very much for your time this morning.
Thank you.